Lori, are you on the correct one? Hey everyone, welcome back to House Healthcare. Sorry for the delay. We were trying to get a new spreadsheet, which should also be posted on the committee page or will be soon. So I just want to be clear about one thing. So when we did this draft of the new spreadsheet, updating the numbers in the columns, I asked that a couple things be removed. There's a couple things that are being removed are part of the governor's budget that because contractually or because of a legislative mandate, we have to fund. And so when we do our budget letter to appropriations, I will suggest that we write it in some form of we approve the governor's budget except for if we make any changes. And we will be clear that it's not just the items on the spreadsheet, but it's, so I just want to make sure that just because we remove them from the spreadsheet doesn't mean they're not going to get funded. Okay.
When you're mandated to fund these other things, you have to fund it at that level?
I think the question would be, yes and no. Like if we ask the questions of whether or not it should be mandated, what is the level? So that one was just a $25,000 one, which they explained that it was for 2 people's time to do conflict resolution. Yes.
I just wondered in general.
Yeah, no, I mean, unless the dollar is mandated in legislation, then it would be a conversation to have with the agency. Yes. Okay. So, we always start this and I know where to start. Okay. We're just kind of going to walk through all of these and we're going to hear what people have to say in general, not spending a lot of time on any of them. We will get to a point where we will prioritize. Base funding is different than one-time funding, right? So base funding would be funded year after year. And there is not a lot in this budget of base funding where we can take from somewhere to fund something else. So that's an issue. One-time funding, I have an idea for that I'll put up on the table when we get to that point. So I think what I would like to do is start with base funding and leave the one-time off to the side. And unfortunately, I think something happened with these. So I have a big gap. Maybe I should have a big gap. I think, David, did you put this in there?
It's a language that needs to.
Made it so big.
But it made the row.
What's the language? Oh.
Blame it on Daisy.
No, I thought language. Yeah. That's fine. So that would just be something like something put there to be.
Okay.
Different.
Holding space.
Okay. So. All right, so we're going to start with the third row that says, so on base funding on the first page, this is all in the governor's recommend. So the first row is Vermont Nursing Forgivable Loan Incentive Program. This is the state share. It gets matched by Agency of Human Services. This is for the programs we have going. I don't know if it's AHAC or VSAC. We did joint testimony with Commerce on these, and we've been funding them for a couple of years.
This is an increase.
This is an increase, which is even better. Okay.
What methodology are we using for our prioritization? Do we each pick 3? Do we?
I think we're going to do 1, 2, 3.
Or just 3?
Yeah.
Okay.
And then we can go from there if there's more.
Okay.
And I am going to do base funding versus one-time funding separately.
Okay.
Okay. So this is an increase to the Nurse Forgivable Loan Incentive Program, obviously a workforce issue. We've heard good numbers from VSAC and AHAC. I forget which one does this program. I think VSAC. Yeah. On this. So that's base funding. Then if you skip the next row and you go to DMH maintain the 988, that's base funding. $451,254 for a total of $190,294. Now, remember, with the governor's recommend, we don't have to prioritize these, right? So we should just be saying if we don't agree with this funding at this point.
So these are all in the governor.
This is all in the governor's recommend.
You will identify ones that are not.
Yes, there's a whole different section for that.
Yep.
And then the PNMI, the next two are base funding. The governors recommend. So let's stop there. Is there anything here that we're like, no, we don't want to do that? Have questions on?
I'm still stuck on our prioritization
Yes, all right, let's
methodology.
stop that.
Are we only going to prioritize things that are not in the governor's
Yes.
recommend?
Yeah,
Okay.
we are only going to prioritize what is not in the governor's recommend. We will do 1, 2, 3, so you have to pick priority order. We're going to separate base versus one time. And so for the governor's recommend, if there's things that you're like, I'm not sure we should be doing this, that's what's on the table right now.
And the amounts are the governor's amounts?
Yes.
Okay.
Not all. Some of these are increases.
Right, but it's increased with the governor's recommended budget. This is all what the governor put in his budget
Yep.
right now.
I think what I document it's the figure that's here, the figure that was in the governor's
Yes.
budget.
Yeah.
Yes,
So it's exactly the same?
yes, in this section,
Okay.
yes.
I thought that some of these were increases. Okay.
No, this is all, what we're talking about right now is all in the governor's recommend.
Okay.
Yes,
It may be increases from the prior budget year, but it's
Right.
not anything that we added.
It's
as a
not,
committee.
correct.
Okay.
So the psychiatric residential treatment facility.
We're not doing one time yet.
Oh, I thought.
We're looking at the
This
base,
section.
yeah,
Okay.
so base funding. All right, is everyone good with the increase in the nurse forgivable loan program?
Yes.
Okay,
Yes.
so that's a yes.
Yes.
You want me to fill it in? Is anyone not?
For recording, do you want me to put? Yes. when you say
Yes,
Okay.
that would be great. Anyone not interested in increasing or keeping the nurse loan forgivable program? Okay. But we maintain the 988 suicide prevention line. Alyssa?
Oh, no, just
Alyssa's,
thumbs up.
is anyone not interested in maintaining the 988 line?
I'm interested in maintaining it, but I wonder about the money in each of these. That's all. I
Okay.
mean, I know they've presented and I know that this is what they've asked for, but sometimes what people ask for and what we can afford could be two different things. And I'm not picking on that one. I'm just saying any of
Yeah.
these. And I know the governor recommended it, but that doesn't mean we have to.
Yeah.
I don't know. And maybe that's something appropriations will do, go through it, but no, we can't do all this. I don't know whose job that is.
So, I mean, we can, on any of these, we could say, no, we want to fund it, but we only want to fund it on 100,000, right?
Gotcha,
We
okay.
can do that on any
All right,
of them.
okay,
I think
yeah.
we have to think back to the testimony we received from DMH,
All
what
right.
the money's being used for. There's grants that are helping this. And then I will also say, the committee across the hall is looking at a bill on something else, but potentially some of that money could be used to pay for 988 in the future. So I would say, make our decision now, and then next year, the people in this seats, we might have a totally different conversation.
And I'm
Does
just
that help?
picking on that one because it's there,
Yes,
not
yes.
because I think it should be
You
less.
could totally choose, and I'm gonna make a proposal on one of these that's gonna get exactly to, I think, what you're saying.
All right.
You don't need to do all of it.
Okay.
All right, anyone against 988? Okay, so yes on that, Melanie. So the next two, the PNMIs are really things, I thought we had taken these off, so I apologize, are really things that are part of rule changes that we should be doing. So I'm gonna say yes.
Yes.
See if there's any more on top for base funding for the governor's budget. So can we skip the embedded mental health for right now and turn the page? So the governor also had, and all the stakeholders agreed, there's no cost associated with it, but this is how the Green Mountain Care Board does bill back. And they're changing the percentages, if you all remember. So it's net neutral. Are we good? They all came and said yes. Okay, so yes. We're gonna do language in the afternoon. So we can skip that one. And then we start our proposals. So go back to the first page. I'm gonna talk about the embedded mental health workers. So this is base funding. So there's currently, and the numbers were a little hard to follow and we're still waiting for written testimony, but there are, I think he said 10 positions, something like that, that are currently 11 that are currently funded. But it's been funded by vacancy rates and that's going down. So there's some still base funding. I think there was the need for 500, and correct me, Daisy and Melanie, if I'm doing this wrong. 585,000 is needed in base funding to keep what we have. And add one position. Because the original was for 12. So that would get us to 12. And then they're asking for 8 new positions to get to a total of 20.
Right.
And so the total, so there's a couple things we could do. We could say, sure, we're going to fund for the 12 and add 585,000 and not add any additional workers. We could say we're going to do all of it, which would be 2,476,000. General fund, there's no match. So go ahead.
Or we could say 14. 12 to 14, you can do in between.
Yeah, you could do anything in between. You are right, Alan. I'm going to throw something on the table for discussion. And I don't remember who was here when we started Vermont, this program, but it was started several years ago when we really were lacking a lot of programs in mental health outside of the DAs and SSAs. I think it has been huge value to this point in time. And I believe there are programs being stood up all over the state like this. So in Chittenden County, I know we have people embedded within Howard Center that work with the police. And I know those types of programs happen in other parts of the state as well. We also have now 988. We also have started a statewide mobile crisis, which means 2 people can go out to any call that anyone makes, including Vermont State Police. We now have, this pilot program, we're working with the urgent EDs, urgent mental health, urgent care. And we have a robust DA SSA system. So I don't feel, and this is for discussion, I don't feel we need this program anymore. I feel like if we're really looking at creating a system for our mental health of our Vermonters, we need to be working in the system that DMH is putting together, that we've all been supporting. And that if we didn't fund this, it would mean those workers who are currently there, who are DA workers, if we fund it to go back to the DAs. So I'm not saying get rid of the money. I'm saying use the money in a different way. And those workers stay with the DAs. We match it, because this is matchable now if we give it to the DAs. And we work within the system of care that we have. And Vermont State Police, if they have an issue, they can call 911, they can call statewide mobile crisis, they can get the DAs to come out. So I'm just putting it on the table. I think there's probably a lot of questions. So this is not a decision to be made right at this time, but I want us to have a conversation. Right.
I'm mostly in agreement. I definitely don't think, adding another, 8 positions and funding 20, especially when there's only an indirect nexus between the embedded, workers and, our system of care for mental health. I do think that there's been a positive impact upon the system of Department of Public Safety in the influence that, they're not all clinicians, but the mental health workers have brought to the culture of the Department of Public Safety, which I think is helpful. So I am in agreement with you, but I'm concerned about that piece. Is there a way where we can still make sure that people who are having a crisis, and I think you just talked about it, maybe you could flush that out a little
Sure.
bit more. It's when they call a crisis line or someone calls it on their behalf, that a uniformed officer won't automatically be the person sent to a mental health crisis. You know what I'm saying?
I know exactly what you're saying, and I would say we don't know today whether or not it's just a police officer goes, right? So even because this program is in VSP, doesn't mean that every single time there's the mental health crisis, a mental health worker is going.
That
But
I know.
yeah,
Um,
so I would say, and what we would need to think about is, those Morning Fox was here and we talked, and I asked the question, like, why are we not using the system we have? And his comment was, well, people know to call 911. Well, Vermont State Police can be trained to call 988 for the
yeah.
statewide mobile crisis.
And I wasn't convinced by the testimony that the number, I think, I think he made a correlation between the officer involved only number reduced by 1/3 because of these mental health workers. And that nexus wasn't convincing to me. I don't think there was enough evidence to show that it was.
Yeah, and we're still waiting for the written testimony. Art and then Alyssa.
I want to understand the system you talked about on the ground. What does it mean? So we're talking about these folks won't be embedded with the state police. They'll be with the DAs.
Okay, so when the program was created, I know Brian was definitely remembers this. You were all here. Okay, so when the program was created, we were concerned about it being just under Vermont State Police. So they're actually hired by, okay, so everyone was here, so I apologize. So they're hired by the DAs
Everybody, not
and
the new one.
SSAs. More than less. They were hired by, and we verified this with Morning Fox, they are employees of the DAs.
Okay,
And they are embedded with the Vermont State Police barracks.
yeah.
So Vermont State Police is on a call or gets a call and they're like, we could use a mental health worker here. So they call and see if that person can come and they help. Absolutely, definitely needed program at the time. Still needed to have people go out in place of police officers to work with patients who are in a mental health crisis. In fact, I know Brian could tell us all day long how important it is that Vermont State Police, any police, sometimes isn't the best thing. It should be. So my point is, has this program had its effect and run its course? Right? Changing some culture. People understand mental health clinicians should be called. And since this was put into place, we've established 988. We have established a statewide mobile crisis. We've established urgent care centers that people could be taken to. So can we now work within that system and say, this program was really great and it was really helpful, and it's time to move it to something else?
Well, here's the thing, these folks are already members working with the DAs, correct? I mean, that's what we're saying. Why
They're employed by the DAs.
employed by the DAs?
They work at the Vermont State Barracks.
We're in the barracks.
With all that said, why is there any budget? Because they're already work for the DAs.
Well, because the DAs need to be able to pay them.
Okay, but that's not in their own budget?
No, this was a program started specifically this is the budget for that program.
Okay, but, and this money goes to the DAs to pay these?
To pay these people, yes, right.
Okay.
And so another thing on the table could be, we're just gonna eliminate the program completely, but then we would be eliminating, those positions, and that's,
Yeah. All right.
Alyssa, and then Topper, and then Brian, and then Bobby.
Just want to be clear about which, okay, so we do have a statewide mobile crisis now. Essentially, what you're proposing is that we move these people out of the Department of Public Safety and put them back in the DAs, which they're already employed by the DAs anyways. And they become part of the system of care of our mobile crisis, which doesn't mean that the state police cannot have access to them to say, hey, we need you.
Right,
They're just not embedded in the barracks.
they're just not embedded in the barracks, and they're not specific to mobile crisis.
Yes.
They're back in the DAs. We can now match to draw down more
Yep.
money. So there's more,
Yep.
more capabilities there. And there's Vermont State Police can still work with any of these folks.
Yep.
But when we created this, we didn't have all of that.
And I just remember some testimony that we heard, which was compelling, and has been a godsend, I know. But I do recall that there was testimony from somebody who was embedded in the barracks. And she indicated that there could be days where she had no calls, and then she could have like a day where she had worked with calls all the time. So this almost,
That was I think of one day she mentioned 3.
yeah. So
3
this-
calls.
This seems to be putting them back into our DAs. It seems to be a system of care. We can draw down federal dollars, first of all, for them, which we're not getting here, and they become a little bit more efficiently in the continuum of care that we
Hopefully,
have.
yes.
Hopefully.
Sorry, Bobby. Sorry. Are you?
No.
Good. Bobby? I don't know.
It was Hopper, Bobby and I was in the hole. You know, what's it on deck?
The extra money that we get by drawing down more money. Are we talking about adding new positions in the DAs? Is that what
So-
we're talking about?
So potentially, so this funding here, this 2 well, no, not necessarily. I think what we would be saying is they would keep the positions they have, right, which are 11. And then we have this additional funding that could go for rate increases to the DAs.
Well,
Here's
my
a different-
position would be, I'd rather see the money go to adding more people, because this is a program that's proved itself. And you put it back to the DAs. Now the municipal police can use it as well. If there are more people available, you'd make a good program bigger and better.
Okay.
I'm a little confused, but are you saying you support moving it to the DA?
Yeah.
Okay, so you're saying like even though it
The money that we
works,
get from the match, use
Okay.
that to fund more.
I see what you're saying. So you're
That can be
agreeing with
used by
the chair.
local and
Yeah,
state police.
okay,
Yes.
all right.
Bobby,
Okay, I think Alyssa kind of already brought this up and you said it, but I just want to clarify. If we send the money directly to the DAs and not through the Department of Public Safety, we can draw down federal dollars, basically magnifying
yes,
the money.
Yes.
And, well, because, you know, the towns that I represent, we don't have any municipal police, but we have the state police.
Yeah.
But at the same time, they would still be available for all, and like what Topper was saying, if we put them back in the DAs, they might be more available, or at least they wouldn't be tied to one for the police agency. The sheriffs could use them, the municipal could use them, the state police could still use them, as long as they get to keep their flak jackets.
The other thing that's,
I'm not really joking, but I mean, as long as this program, armor, body
We
armor.
don't get body armor jackets as crisis.
Okay, so,
Anyway,
I wish I had one of those.
That's what Bailey was talking about, the young lady who was here from
Oh.
the program, the embedded program.
Yes.
You should wear them when they show up. The point is, if it means that there's more of these folks available and we get more federal money, I would.
so I want to be clear, it doesn't necessarily mean there's going to be more folks available, right? So there's, unless we say so. So the one thing on the table is we add people. My thing on the table is we increase rates for the DAs. So those are the two things on the table right now, as is funding the governor's recommend. So we're just putting things on the table. We're going to come back to this afternoon. So I want to be clear about that. We're not, and I want to get some more information first. Okay. Brian and then Alan.
Me too.
I know, I got you on there. Brian.
So I can say from experience that partnership between mental health workers and the police is good and it works and there needs to be more of it. So my concern here is that there's inconsistency. Like some of the workers might be QMHPs, which is a high level of training and power to like commit someone into, you know, like the emergency evaluation process. But then other people may not have that training and they're just calling them like the cop's buddy to talk with. And that to me, like that kind of inconsistency is concerning. Also, there's inconsistency between regions here, like some barracks have them and some don't. And right now, we do have all these new programs that are launched, but I feel like it's not all well coordinated yet. So instead of creating more silos, I think we need to have better coordination. And the DAs are a system that is in place that has catchment areas that are the DAs are coordinating within those catchment areas. And so I would like to see us invest more in the mobile crisis response that's happening through the DAs. And if anything, just encourage, or not encourage, maybe we mandate, we say that there has to be increased coordination between the apparatus of public safety, like just increasing that. And one of the ways might be through like the dispatch system, because when you call 911, they have the ability to say, let me put you through to 988. So like, it could be that before the state police are called, if it's a mental health crisis, like that there's and we would need to probably hear, and that's also GovOps area, I think.
Yeah.
But like, well, you know, it could just be that when someone calls for help, that I believe it's called a sequential intercept model or something like that. Like there could be a better, like they could be channeled to the mental to 988, and 988 might be able to screen things on the phone and not even have a person need to go sometimes. So I would like for us to push for better coordination between law enforcement and the designated agencies. I'm not saying it's bad. I'm just saying let's keep building on the strengths of the partnership that exists and create a better coordinated mental health system versus like a little sort of fiefdom of mental health embedded in the police that's not as well integrated. And also, I just think that the people deserve a consistent professional response. So that's why I would prefer, I just think the DAs have the infrastructure in place to provide the clinical supervision that work, like what kind of, for example, because like you said, I could talk all day about this, but
Yeah,
like,
let's not talk about that.
I'm not going to, but I'm just saying like this, I'll give you another example. Like in the mental health professions, there's a culture of supervision. And granted, we're so busy right now, it's hard to get that consistently, but you sit with someone either with greater experience or with peers with equal experience, and you talk about what happened and you learn from it. I have not seen that in the culture of law enforcement.
Right.
And unless, and I don't think a mental health worker writing in a police card a scene is going to change the culture of law enforcement at that level. it may change on a micro level things, but what I see happen more often is the healthcare workers get pulled into the culture of law enforcement versus vice versa.
Yeah.
So I would prefer to see us
Yeah.
focus on building up the mental health system of care. And then if law enforcement wants to adopt practices of supervision from the mental health professions, that would be awesome. But this isn't the way it's
Right.
going to happen. It's going to happen from the top down. So I could go on, but I'll stop there and just say I think that there's many reasons why we might not want to put more money in this area and put it into the DAs and into the other systems but not cut this. And then maybe over time through the partnership, the workers who are working, riding in cars and stuff could be sort of retrained and placed into the crisis jobs in the DA system, versus like being in the back.
So are you saying you want to keep this program?
I wouldn't cut the existing workers yet.
No, we're not
Yeah,
cutting
yeah.
any workers.
I wouldn't,
But
I
are,
don't
so
want to
you
expand
saying,
it.
you're saying you don't want to expand it, but you want to keep the existing workers in Vermont State Police
Yes.
Barracks?
For
Okay,
the time, and
Police?
I want to keep the existing ones, but not add additional ones. So like their request for more money, no, but we will fund the existing program. But over time, I'd like to see a transition for those workers to be better integrated into the system of care. But I wouldn't just suddenly like let go people who are doing good
but
work.
we're not letting them
We're not letting
go.
them go.
They would be in the DAs. They would be fully in the DAs. So they would not, so they're DA employees, they would stay DA
It
employees.
just wouldn't be in the
They just
DPS.
wouldn't be in BS,
DPS.
DPS. So think about
I'm
that.
okay with that.
Think,
I'm okay with that as long as there's a transition, because the sudden changes to the system of care are not good. And sometimes it's like a roller coaster ride being a worker, and like one day it's this, and then like suddenly on July 1st, it's that. Like that's gonna be not good either. But if there's some transition, so because what I don't want is the state police to feel like they don't have the support they need with mental health calls and the people to not get the help they need. But I also think that the model of like having siloed mental health workers in these little fiefdoms of barracks is not a well integrated system.
Right.
But I think that the practice of responding to crises with mental health workers, like mobile crisis, is a great practice, and that the partnership we do with police is very fruitful. I can give you many examples of times that I've worked with the police in the last 2 years that like they go above and beyond with me
Right.
to try to like help people, and I want to give them credit for that. But I'm not embedded in the police. Like I'm
Right.
embedded in the designated agency, and we make it work. So
Right.
yeah.
okay, Alan.
I don't know now.
Forget it.
No, I think it's a good idea. I guess a couple of concerns. None of these people would have to relocate. They'd still be in their areas, okay? And could the DA still keep some of the busier barracks? Continue keeping that person at those barracks?
We would have to talk to the DAs.
Okay, so it's not a bad idea.
Well, you're missing the
What?
question now.
That's what I'm
Question,
having trouble with. If we could really elaborate on the ideas, that was one thing. So baseline is 7. Keep 7.
No,
and-
baseline, so baseline is 11. So right now there's 11 people in the barracks.
Cause we said 10 and he said no, it was 11.
Yeah, it's 11. And I'm gonna say these numbers are not gonna be exact because we have nothing in writing yet from Morning Fox. Okay? They have been funded through vacancy savings. So the first question is, if we want to keep what is happening today, we have to the governor is recommending $585,000, again, generally, to keep what we have today. Because it's no longer, we can't pull it from somewhere else. So that's the first question. Then the governor is recommending that we add 8 more people. And so the total ask is almost $5 million state dollars for 20 people to be in our barracks, to be available for calls where someone is having a mental health crisis. Hold on. So my suggestion on the table, and there's others, my suggestion on the table is whether we have a transition or whatever, but we say that program worked really well for the time that we needed it. but we now have these other things in place. We want to reallocate our money to what's already in place and is more of a system. Another idea on the table?
Well, the other thing too, Laurie, they recommend is we increase the rate.
What?
I don't think there was a rate increase.
No. Yeah, so that's separate. So this is just, that's where we are right now with this proposal. And then if we decide we don't want this program anymore, the conversation is, well, what do we do with this 2.5 million? My proposal on the table is we give it to the DAs for rate increase. Right? So the DAs are the ones that are doing mobile crisis. They're handling, our most vulnerable. They have to handle certain populations. So we move the money over to them and then we match it. So it would be rate increases. So if you go to another page, they're asking for 7.1 million for rate increases. So that would be some of that. Hold on.
So
Hold on. Topper's saying he wants it to be specific to hiring more people.
And that's part of my concern is if we reallocate it to the DAs, how do we know how the DA, can there be language to say that?
We would, yes,
For mobile crisis, for emergency, whatever.
we would do that.
And then, yeah. So let me just make sure I understand. So the baseline, which is 11, is untouched. That's in the governor's budget. And what no.
No.
So that's why I'm not following it.
So in the program running today is being run on vacancy savings and they run out of money.
And that's
Right.
11 people,
That's 11 people. Well, yes,
whatever.
yes.
Yeah, around there.
So the governor is saying, I need $585,000 to keep the program going. And I want to add more people,
8.
8. Okay, are we all on the page there?
So that will be 19. That the governor-
20, governor wants 20.
Jeez.
Governor wants 20 people. Okay, so the question is, forget my proposal on the table. First question is, do we fund what we have for
585.
585? Do we add 8 more? Or do we say we think this program, although it's working, we have other things in place that we want to invest in, and then we have that conversation? Okay, so I'm going back to my original list of people. I'm adding everyone, but Mari's next, then Leslie, if you have something else, then Daisy, then Alyssa.
Brian got at what I initially spoke about in my concern that systems and cultures take time to change. And until they change, whether it's through continuing education or exposure to another way of doing things, all of us rely on, talk about embedded, our learned memory, our learned responses, especially when there's a crisis involved. So my concern is what happens at the moment there's a call. Do we have enough in place systemically to make sure that, with all good intention, if the first responder is a uniformed police officer, or if what's it called, the people that dispatch, thank you. The dispatch person is used to calling on uniformed police officers. How can we make sure or mandate, I think like you were inferring, that the appropriate that it gets channeled to a mental health person when that's appropriate? And instead of relying on systemic memory and personal memory of how they were trained. Does that make sense? So
It does make sense.
I know this is a budget bill, it's not a policy bill, but I have that concern because we've seen it happen. We've seen it played out in the community where the first responder was a uniformed police officer, and didn't have the tools to address a mental health crisis, and bad things happen.
And I would say we should look at that as a separate issue from this and we can take testimony on it. And I think it's not necessarily something we can mandate. I think it is a cultural shift. And I think having 988 and having the mobile crisis and having the DAs, I think we're getting there, right? But I don't think we can mandate, everyone a mental health worker has to be called on everything because they may be called and we don't have one.
Yeah, I don't think that
Right.
would be the mandate I would suggest, but.
So can we talk about that as a separate policy
Yeah.
discussion?
You
Hold-
too, Brian?
Hold on. I want to go and can you write it
Yeah,
down?
I was gonna say, is I'm writing some language
Okay.
and I'll share it
Perfect.
later, yeah.
Okay, Leslie, did you have other questions? Or
Yes, and I
comments?
probably should know this, but I can't seem to know it. How much is the cost of the whole program? Like that you're suggesting that we move from DPS to
So the
DMH?
cost of the current program is approximately $936,000. But to keep that current program, we need to put 585 in
To add, to keep the current
to
program.
keep the current
But
program.
what's in there is 936.
But and then to add the 8, we're looking at that number that's in our spreadsheet of the 244.
I think that what's really important is the matching, that using these dollars to leverage more people is really crucial because we need every dollar. The question I have is, I know we have all these new programs, which are great, the 9-8, but are they developed enough, mature enough to fill in right now? Or are we still in a transition moment to get there? And that would be my question. I have no idea how to answer that question. And I don't know who would, maybe someone else, but that's my concern. And then my also, once said earlier, and Brian's working on language, is how do we sort of guarantee, if we want to, that this money is used for emergency VA care rather than just cost at some other program or wherever they think they need it. So that's my concern.
Art?
Yeah, I kind of going back to the process here, and proximity and timeliness is my concern. So with your plan, Lori, do you envision if that happened tomorrow, would these folks be at the police barracks or somewhere else?
It'd be in the designated
It'd be in the
agency.
designated.
But how close are the designated agencies to Wawa State Police Barracks
Depends.
physically?
I think forget the physical nature of it. I think the issue is we would be giving money to the DAs,
Yeah,
right?
yeah.
To handle the calls that come in, the crisis, and
But I'm a police officer. We've got a call that's coming. We gotta go
Well-
now.
Morning Fox
Where's the guy?
said the catchment areas, so DAs have a catchment area, Vermont State Police barracks have a catchment area. They're pretty close, some overlap.
That's all well and good, but yeah, I'm just,
I understand where you're coming from. I would also say, like, I'm gonna pick on Enosburg, right? So you have Vermont State Police, but the call is coming in 50 miles away from the barracks. Could be closer to the DA, could be closer to the barracks. I mean,
and that person's out doing something else.
right.
You had no control over it, and now you have no one. The police go out by themselves and it's not appropriate.
Well, and the police are going out by themselves. I forget what the number Morning gave, but they're not going out on every call. I mean, the
No,
mental
no.
health worker isn't going out on every call.
I'm just trying to see how it physically would work.
Yeah.
That's all. I mean, if that next day the person's at his DA, which could be, 50 miles away,
Right.
like you say, it kind of it takes the
Katie will be right.
fizz out of the program.
Yeah.
I think, okay. Yeah, just so I understand.
Yeah, no, and again, this.
Yeah, theoretic.
So, I want to do Daisy and Alyssa, I apologize, I missed you both. And then we are going to switch to Katie walking us, we're going to have to switch topics.
I'm first of all, like, so impressed at everybody's perspective and just the way that everyone is looking at this, because it's a really challenging issue. I want to support, I think we all do, people getting care that they need, and also support law enforcement officers when they go out. And this is something that we want to say works, but I'm not convinced. This is one thing that I don't know if I agree with the chair on. You said that it was a good program and proven effective. And the only thing I don't agree with is that point, because when I looked at the annual reports from Act 154, they didn't have any data, and they specifically said that, and they had beautiful stories of how people-
Anecdotally, yes.
Yeah, and so I just, I think budgeting for these things and specifically for mental health care is, and, community-based services that tie into public safety, I think is so hard. And so I'm trying to look at this from both a systematic and a strategic way. And when I think about it systematically, what's our return on the investment? Do we have the data and the outcomes to prove that? And so, Leslie, you were talking about the importance of having a federal match. That's really helpful when we look at the return on the investment. And I think, the data factor is missing here for us to really look at what is the return on the investment. And when we look at this as, strategically, I'm trying to reflect on what our principles are. And, supporting a positive experience goes to like Art's point about people really having access to a, rapid response in a crisis. And, strategically, we want to build on the successes of what we've already done in past years around this table, and also take calculated risks to advance our system of care. And we've done that recently with investments in Blueprint, right? Like the community health workers, which we haven't seen outcomes on yet, but
It's coming in March.
yeah, and I feel like there are investments that we've already made in these kind of in the crisis continuum, and those get brought into us by the Department of Mental Health. And this is kind of standing alone outside that. And so I just feel like strategically it needs to be in that package. And as much as I do not like to silo things, I think that we need to have a full picture of what is the return on this investment. And we're not getting a full picture of that if this is outside of where the reporting is happening, where it's being budgeted, and most importantly, where the strategic planning is happening with the expertise of the designated agencies of the image. So I'm absolutely with you, Lori, except.
Yes, I would agree with that.
And I'd love to see, that money, I mean, I'd love to see, Brian had some excellent and really great input on, how this works in practicality that I think is really, I don't have any strong feelings about keeping the workers there right now, but like, I feel really strongly about making sure that the designated agencies are using these funds to complement their NDMH's goals to have a really comprehensive crisis care continuum.
Thank you. I know, sorry.
I have no programmatic questions. I'm strictly money here.
Yeah.
Okay, so I'm trying to understand what you're proposing.
Okay.
So you're taking 2,476 general fund.
Yep.
And you want to put 2,476 general fund to the DAs.
Yep.
In rate increases.
Yep.
Not a total gross to the DAs of 2.4. So
No, we would
basically you're
gross it up.
talking like $6
$6 million
million.
would
You
go
want
to
to give
the
the DAs 6 million. So that would fund, I mean, it would give them a rate increase, yes, and I understand they're asking for a rate increase, but it would not only fund, I mean, if we just looked at it in terms of these positions, not only would it fund 12 positions, it would fund double 20 positions. So it would be like, I mean, if you looked at it in this particular program, we're giving money to the DAs to essentially fund 40 or so employees.
Well, not necessarily fund new employees.
Yes.
Rate increases.
Rate increases,
Yeah.
yes.
Yes.
So you're not proposing that we give the DAs enough to fund 12 positions and then maybe move the general fund money to other
No,
priorities?
that is-
You want it to go,
Well, I will tell you why I want it to go, because,
that's what I'm getting.
yes, so just to make sure everyone's clear on Alyssa's question, why are we putting all this money why is my suggestion to put all the money to the DAs and not spread it around on these other asks we have? And my biggest answer is because the intent of the governor's recommend was for public safety. And I think if we're going to move the money to something, the intent should stay the same. And the going to the DAs keeps that intent, in that we have Vermonters who are in crisis. We have people who need to go out to those calls and get it done. And the people who do that is within the DA and SSA system. We could, as a committee, say, okay, well, yep, so we think we should keep the base funding for this, but move it to the DAs. It would still be a match of something. And then we're going to give $1 million to something else. We have a better chance of a proposal that stays within the intent of public safety and Vermonters' needs in regards to mental health, of getting it funded, than we do if we peeled it off and gave it to something else. But we couldn't.
And not only do we have people in crisis, we have an increase in the rate of numbers of people in crisis.
Right.
So this is the
If
last
I
thing, and then we
may-
really have to go
Okay,
to
but-
Katie.
and
But time out. You gave your whole thing.
Yeah, and we're gonna come back. We're coming back.
Okay,
But
but
we
I wanna
need
give mine.
Katie's here. Katie's here, and we need Katie to walk us through the peer support. I want to hold Ledge Council. There are a million things to do.
I just wanted to finish my thought on
Yes.
it, which is by giving rate increases to the DAs, they can do anything with the money they want.
But that's my concern.
We could put intent language in. I mean, we could put in language that says what they have to do with it.
We've done that around raises, for example.
Yeah. That
In the
is, so,
past, we
Okay.
said we wanted it to go to.
This money is only to be used
for
for
something.
this. Okay.
So it wouldn't offset the 6.5% increase that we have later in our requests.
No.
Okay, got it.
So I will
It would
say,
Fund it.
Hmm?
It would fund that.
Well, that's the question, but we can talk about that later.
oh, yeah, my intent would be that then that base, that's
funded.
That's funded.
Perfect.
Not completely, but it's
Yeah, well,
funded.
it's pretty close.
And I am having a conversation with Vermont Care Partners. I broached the subject very quickly. They haven't had much time to think about it. So I wanted to get it out. We're gonna hear Topper later. We're gonna come back to this. But we need to switch to Katie now. So we are switching to peer certification, which I think is H847.
That's right. Got it.
847.
847. So it's the peer certification bill that we passed out. It has been to Ways and Means, and they have an amendment. So this is going to be a walk through the amendment and take a straw poll. And I think it's still in appropriations at this point.
It is.
Okay.
I heard that it may be voted on this afternoon.
Yeah. Great.
Yeah. Well, still, good morning. Good morning.
Good morning.
Oh, it's like it's tomorrow, right? I know it does. Let me pull up the amendment. Let's see.
Just got close.
So I know you've been talking about something else. This was the bill on peer support specialists and recovery specialists. There were some fees around the licensure fee, the biennial renewal, and that's where the changes were from Ways and Means. So the amendment you're looking at has two instances of amendment. Is it up there?
Yep.
Okay. So the first instance of amendment strikes out section 3 of your underlying bill, which is the fee section, the biennial fee. And instead it puts a new section 3 and a section 3A in the place where just one section had been. The reason for that is because there are tiered effective dates. So the second section, which is 3A, amends section 3, and they take effect on different dates, if that makes sense. And then the second instance of amendment is having a new effective date section to reflect all of these tiered effective dates. So with that said, the new section 3 makes a change to the initial certification fee. The default is 115, and your version of the bill left the initial certification fee at 115. This changes it. It makes it one of the exceptions that it would be $50 for the initial certification. And then the same language you had around biennial renewal, you created an exception of $50. So that is still in place. That would take effect July 1, 2025. Section 3A amends the same section again. We are not touching the biennial renewal piece, so that stays at 50, but it changes, it amends the initial certification fee. So the bill in the previous section sets it as $50 as of July 1, 2025. As of July 1, 2027, it changes it to $75. So this sets an exception and then it amends the exception for the initial certification fee. Then you have a new effective date section, which says generally this act takes effect July 1, 2025. Exceptions. This section, meaning the effective date section, and section 5, the rulemaking section, take effect on passage. That's not a change from your bill. That's so that there's a year for the rulemaking to take effect, or to go through the LCAR process before everything else takes effect on July 1, 2025. And then you have the new section 3A that takes effect on July 1, 2027. And again, that's the $75 initial certification fee.
Any questions?
Go back up to the change in fees where you said it amends the amendment.
Yes, so
So they change it 15. So that's the first part. This change. The second.
this is the second part. Did you want to go?
Yeah, go back to the initial.
Okay. So this is the section that takes effect July 1, 2025. Ways and Means, your bill didn't have this B2Q. Your bill defaulted to the 115 for the
Okay, so they're
initial fee.
lowering that. for
So
both.
they've lowered it to 50. Your bill did lower the renewal fee to 50, and they've kept that. That hasn't changed.
Got it.
And it doesn't change in the next section, 3A, that takes effect July 1. The biennial fee stays the same, and it's the $50 that changes to 75 for the initial certification.
Okay, got it.
Any other questions? Okay, can we do a straw vote? All those in favor? Anyone opposed? Nope. Great. 11-0 when you report. Thank you, Katie.
You're welcome.
We'll hear there's a approach amendment, and then if there is, we'll do it again. Otherwise, we'll take it to the floor. Thank you, Katie. Okay, so we have a couple minutes. Do you need to go somewhere?
I have a meeting
Okay,
at.
that's fine.
Is it something I should?
Nope, you're, so, I mean, we're gonna talk about the budget still,
Okay,
so, that's you.
okay.
We're not, but I want to switch off of this topic. I want us to come back to it. Promise we're gonna come back to it. So we went through everything on the base funding for the gov's recommend. Now let's do the one-time asks. So the first one is on the very top of the first page, youth psychiatric inpatient treatment facility startup cost. So this is the beds at SVMC that would be for co-occurring, co-occurring issues, concerns, problems. Thank you. And we had appropriated 9 million last year. And I just sent everyone a memo, so I sent it earlier today. So I'm just gonna read what it says. So the final feasibility study from SVMC included a pro forma and explanation, which includes the 9.2 million in capital expenses for the renovation. So that's what we did last year. And 1 million for initial operational expenses during startup before they are able to open and fill the beds and collect revenue. The state fiscal year 24 budget included a legislative appropriation of 9.2 million. And the state fiscal year 25 budget is recommending this additional 1 million to meet the need identified in the feasibility study of the initial operational expenses. DMH is still waiting for the certificate of need to be submitted and subsequently approved before entering into further contracts. Therefore, none of this funding has been expended, even the 9.2. On February 21st, 2024, SVMC communicated to DMH they are having issues completing their 5-year projection financial tables and could not give an updated timeline on when they will submit the CON. Alyssa, you had a question?
Well, that's the. Never mind. I'm sorry. I have a question on the other. Yeah, I've got a
So let's stick
question on
with this one. Art.
So what happens now? Okay, so we're not gonna spend the 9.2 in fiscal year 24, is that what? Pretty much what it
I mean, they could before the end, but I doubt it.
probably
They're still
spend
waiting.
some.
I'm sure they've spent some of it. Some of it will go to the.
Right, so
CON.
say it's 8
The
million or
CON process.
8.5. So that will do what? Roll over for this for fiscal year 25
Yes.
after July 1st? Okay, and I mean, do we budget for that or does it just happen? Do we know? I mean.
That would be written in the language that it would be a carry forward.
I just wonder, I mean,
Yeah.
these things are always hard to predict how
Yeah.
long it'll take and.
Right, it is. And so, and that's a really good question. So if they haven't even submitted the CON yet, we don't know how long the CON will take. It's this balance of, all right, well, we want them to have the money when they need it. Or this is taking a lot longer than you said it was going to. And so we're going to say no to the one time and it,
Yeah.
goes to something else or just goes back into the pot.
The other thing I just wanted to mention, and you guys did a great job with this, but I don't know how it appears on the thing. But if they put Bennington and Brattleboro on these, it would,
Oh, yeah. That's fine.
it would just
It's in the-
highlight it
it's in
to
the notes.
people.
It's in the notes.
It is.
Yeah, I did that.
Okay,
because
yeah,
I was
all
supposed
right,
to, and they're
okay.
both Bs and my brain goes like that, so I put
Yeah.
it in the notes that this
It
is
actually
not.
would be better in the other one to me, but that's.
Oh, you mean under the.
That's why you have a paper copy. Why don't you write it on yours?
Whoa.
So
I'll do that
thoughts,
for you.
so thoughts on this?
I think we should let the facility be built first, I'm sorry.
Yeah. So I was just, you kind of spoke to it, I want this to happen. I think that that's my first statement. I think it's really essential to have those kinds of facilities. I'm sad to hear that the CON is not gonna be, it's not going as fast as possible, so. My question is, if we don't do this million one time, will it slow it up even more? Will it stop the process? That was my.
Well, if they haven't even submitted the CON, it won't stop the process. It could be that the CON gets expedited and they're able to start doing the construction, which takes the 9 million, and then they come back to us in BAA and say, we need $1 million now to finish it.
There's no path forward if we do it. There's a BA moment.
There is a path forward, yes.
That was just my.
Yeah, but, on the flip side, you could say, well, I think we would need to make it clear that we still fully support this, even though we're not giving $1 million now. Leslie?
I just remember hearing how desperate people were to have a place for youth who had, mental illness and physical diagnoses. And it seems to sort of turn away from that as not the way I would want to go.
Mm-hmm.
It's $1 million. Okay, I never thought I'd think in these terms, but here I am. Doesn't seem like as much as many other things we're thinking about. And I think we have to support the people who really want to address this problem. I really was tagged a couple of times and a lot of anger going through like the retreat and at UVM because they couldn't manage a person who had significant medical diagnoses, and it caused great problems across the state. So I think we really need to stay to that commitment.
Okay. I know. Okay. I know we're not staying on the
I don't
commitment,
disagree with you. I was just
yeah.
asking for process.
But I think once we take, once we start chipping away, I mean, yeah, the CON goes right through. We can move along really fast. Otherwise, then we have to go through a VAA kind of thing. So then we trip up there and who knows what the status of the world will be there. And then, so I feel like let's stick with our plan in the moment.
All right.
I think just the opposite.
No surprise.
Yeah, since we're this far behind with it and we have that money dedicated to it, to me, I think we could use that million somewhere else. And if we have to regroup, I think we can.
Okay. Anyone else?
We've been working on this for years. And, if we put the money there to get done, it is not gonna, by the time we get it done, it's not gonna be enough money. So my personal opinion is we need to keep it there. So that once the CNN is done, they can start right away. We've done planning, engineers have been involved. To me, we need to leave the money there because you're gonna need more money. Because when all of this was done, it cost X amount of dollars. It's gonna cost more by the time they get there. And if money is already allocated, at least they can get the thing going. And you're not gonna have to then try to find so much money to finish the thing. So that's my 2 cents.
Okay, anyone else?
On the topper, I think we made a commitment in the BAA to support the project and basically be partners and support the people who are behind the planning of it and development of it. And I'm sticking with the bond on this and believe that if they say they need another million right now, then I trust that.
So I want to make sure everyone's clear. 9.2 million in capital expenses for the renovation, which they cannot start using that until the CON is approved and they hire contractors. And then $1 million, which is this million, for the initial operational expenses during startup to fill the beds, and then they start collecting revenue. So they would get through the 9.2 million first. But I hear you, Daisy. Who else? Anyone? And then I'm looking for spreadsheet last year. Which I want to look at. So there was a spreadsheet we got last year for this 9.2 million, and I want to see what the time frame was for that of once they approve the CON. So I'll get that and come back to this. Does that work?
And I'm wavering, so.
Okay. Okay, so
It is in the governor's recommend. I just want to make sure that that was.
Yeah, okay, yeah.
Well, we could use it for the healthcare.
okay, so I'm gonna get the timeline on that so that we can talk about that more. Of course, we never get through what I think we're gonna get through. So I'm hoping we can be back here at 1. Is that possible to start?
It's possible, but it might not be probable.
Okay. I would like those who are willing to be here at 1 so that we can have a robust conversation to be back at 1.
What did you say?
Those who want to have so if you can, we have a roast.
Do our best to be here by 1.
Yes, do
Okay.
our best to be here
All
by
right,
1.
all right.
We will be starting to go through this and vote on things.
I might just lay